that was when she really put me with the medical students and said, here, you want to go to medical school, this is what it'll look like. Okay, you don't want to go to medical school, this is what dental school look like. Here, go with the dental students. So I was with the dental students for the rest of their trip. And that was by maybe like a 14-day trip or so in Jamaica across the country, different sites and across rural sites. And that was when I really fell in love with being able with the community in that regard, just being able to triage patients that had drastic health needs that, our little, class can provide that little help right then and there. How do we make it sustainable is really the question I kind of ask myself within. And like, I don't want to be a part of this just, once a quarter type of trip. How do we do that? How does that happen? How does that work? What does that look like in life? And so that's really where also I was influenced to dive deeper and go towards public health.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 105. Hi everyone, Omar Richards here. Thank you all so much for joining me. Be sure to subscribe if you've not subscribed as yet. I don't know what you're doing. Leave a 5-star review so you can let us know how great the show was. Share it with a friend. Be sure to follow me on Instagram at DrPH Millennial if you'd like to support. You can go to thephmillennial.com/shop and check out the merch there. Support that way. You can like it, subscribe, and all those other ways to support. Really enjoyed today's conversation. I like the framing that she brought out with she was in public health and she saw the pandemic come around, and the decisions of that decision makers were making weren't the ones that were most aligned with what she thought would be best. And therefore she took it upon herself to get the education and the experience so the next time the next pandemic or anything like that happens, she would be in the rooms and she would be at the tables to make those decisions, or at least have her voice heard, which I think is a really good mindset to approach and do this type of work. And I will stop talking there so you all can enjoy today's episode. So enjoy. Today we have a results-driven public health practitioner possessing a diversified background experience from coordinating clinical trials, nonprofit, local, and state health system sector. She got her Bachelors of Science in Biology at Barry University, then went on to get her Master of Public Health at Argosy University. She worked as a health outcomes manager before getting her Doctor of Public Health at Loma Linda University. She currently works as Director of Quality Assurance at West Oakland Health. We have Dr. DeLorean Ruffin, DrPH, MPH. Welcome to the show.
Thank you for having me. How are you?
I am doing well. Excited to get this interview in. Using my Saturday wisely, I would like to think to get some good interviews and talk to great people doing great things in public health. How are you doing?
I'm doing good. I'm excited to be here this lovely Saturday morning.
Awesome. Yeah, and I know that you're on the West Coast, so we have a little bit of a time difference here, but really doesn't matter, does it?
Yeah, no, it doesn't matter.
Yes. Yeah. So how have you been coping during this time, during the pandemic and everything?
How have I been coping during the pandemic, during this time? Working, honestly. I feel like I've really dived deep into my work and my career and just furthering my academic career, my professional career, just developing myself. And so it was really an opportunity for me as a public health student when the pandemic hit of, now, what do you want to do? Because the possibilities are infinite at this point. The doors have opened up tremendously. It's unfortunate, but it's the reality as a public health student that there's a lot of opportunity right now. And so I really had the opportunity since 2020 to really just, further educate and train myself and learn and explore more in the field and what that looks like in different settings. And I've been blessed. So to get me through, I really had a strong community. My parents have become my best friends at this point of my life. And without them, I probably wouldn't be able to cope that well without their support. So I'm really blessed in that regard to have a support system to help me cope through this.
Yeah, that's absolutely important. Everyone needs that community, that support system, especially when times are hard. And I can imagine that they've been hard for many of us. And
Right.
during the pandemic, you were in your DrPH program. Am I correct?
Yes, I was. I was right in the middle of my program. I just finished my comp exam, so I was fully invested into my concept paper for my research that was turning into, at that point, my dissertation project. And so everything was hitting full swing. I was really getting deep into my research at that point, and so it was kind of perfect timing because everything went hybrid, and we are already in a hybrid program, and it just went fully remote. And so it's kind of an easier transition in that regard with Loma Linda University's program. So it wasn't too bad for me as a student, that transition. It just, took up that in-person contact. That's all.
Okay, awesome. And I'll definitely dive into that when we get to your Doctor of Public Health parts of the journey. But thank you for sharing that. And I look forward to hearing about how all that works out for you. So tell me, how do you identify, and tell us a little bit about your personal background?
I go by pronouns she and her. I'm personally from Cleveland, Ohio, born and raised, also by way of Miami, Florida, and Seattle, Washington. Throughout my childhood, I grew up in those cities. I truly call Cleveland home, and my second home at heart is Miami. And this really influenced where I've lived, and it's part of who I am.
Yeah, and just tangential questions. Since you said like your parents were a huge support system and whatnot, are they with you in California, or where are your parents located right now?
No, they're in Seattle. They still live in Seattle. I can only take so much of living there at that point in my life. And so after high school, I did not apply to any schools on the West Coast. I applied to all schools everywhere else except for anywhere near Washington. So,
Okay,
so they're still there.
okay. So your family moved from Cleveland, Ohio to Miami to Seattle. Is that how it was?
Yes.
Okay,
Yeah.
awesome. That's interesting. I feel like you don't hear many people do. Were your parents in the army?
No, my dad's job took him a lot in travels. And so, just relocated a couple times.
Okay, yeah, because I feel like that is not very common unless your parents are like in the military and they're moving a
Right,
lot.
right. I get that.
Especially like the moves you made from Cleveland to Miami to Seattle, which are like pretty drastic moves. People will technically say it. I don't know.
I know, yeah. I think that's what helped me as an adult be able to move on my own across the country, just having that experience as a child, making that such drastic move from Cleveland to Seattle for
Yeah.
me really kind of
Yeah.
set me up in that regard.
Yeah, definitely. That exposure definitely does help as we do get older and mature into our own people. Um,
Right.
yeah. So before we get into your bachelor's story, and I want to be anywhere near Seattle, what does public health mean to you?
For me, public health means prevention, right? It's really educating and training individuals on different various concepts and different things of doing the most of whatever it is that they do, where they live and where they work, usually how can you prevent any negative health outcomes in that regard? How do you do that, right? And that kind of thinking is what public health means to me, and how I navigate and operate in the workplace and throughout life, is really having that type of mindset where how can we forward think in this situation here? How does that look like? What are we doing here? How do we make this better? And you have to do that and meet people where they are and really empathize to, gain change, any type of change movement. You really have to empathize and meet people where they are, and really make them feel heard and listen to in order to apply those concepts. And so that's what public health means to me in various settings, from the clinical aspect down to the workplace, the cubicle, whatever, what have you, whatever that looks like.
Yeah, and I think that's important to highlight, because you mentioned like not only like the community aspect of it, but
Right.
workplace and the public health in the workplace, which is something that we oftentimes don't think about, or oftentimes forget the importance of that, especially that we well, not right now, but we used to go into the office and spend a majority of our time in the office and thinking about how are we showing up and having the best and most healthy experiences in our workplaces is a
Exactly.
huge part of public health. So you're in Seattle, you're in high school, you don't want to be in Seattle anymore. So you went on and you got your Bachelors of Sciences in biology at Barry University. So tell me, what was that thought process outside of not wanting to be in Seattle?
So a great influence in my life is also my grandmother who lived in Miami. And so when I would go spend my summers, I would spend my summers with her down there in between living in Seattle and high school. And so she was a public health nurse actually and an RN and had a really big hand in the movement for prevention HIV education and treatment in Miami Beach, specifically in the early 90s and late 80s. And so I will go to work with her, and that kind of influence, I noticed, my need and wanting to help the community and be a part of that change and be a part of something like that. And so I went and got into biology, and she was kind of always in my ear. She worked at Jackson Memorial, which was about 20 minutes away from my school, from Barry University at that time. And so just being able to pop in with her, and she even at one point was part of the clinical rotation nurses at Barry University. The nursing students will come to her job. And so being able to have that close relationship and being able to have those conversations with her, for me, helped me see the need for, public health, like just open my eyes to that, really, to that world and what that looks like.
Yeah, and that's awesome. A lot of us who want to do this type of work do not have people in our lives that have that experience of public health, or even know the word for public health. So that truly is awesome, and probably fundamental to you knowing what public health was. And I guess to the point of her being a public health nurse, was that something that you were thinking about pursuing, like being a public health nurse, or no?
No,
Tell me more
no,
about that.
no. That woman worked too hard. She was a psychiatric nurse. She did so many things as a nurse, and I was just like, this is a lot. And that's a lot of empathy too, right? That's a lot of sympathy. That's a lot of caring and operating in that regard. Sometimes for me, I don't have that. And I don't, nurses are super human. Nurses are superhuman. They have something in them that I respect a great deal, but I know that in particular type of patient care wasn't for me.
Yeah, and I think that's important to know as well, because
It
nurses
wasn't for me.
definitely do a lot. And as
They
you
do.
said, there's a lot of empathizing in there, and you really have to have that heart to want to continue to do that type of work for a long period of time, through all the ups and the many downs that do come with the nursing role. So yeah, fair enough. Like, at least you're able to get the exposure to the public health part, and then you're like, this nursing part, that doesn't seem like it's so much for
Yeah,
me.
I
But
knew there was something else there, just not sure what, but
okay,
it was
fair enough, fair enough. So I'm guessing that you knew about the term public health throughout your undergrad time in undergrad. Is that correct?
Actually, no. Throughout undergrad, I really focused on biological sciences heavy. I thought I wanted to become a medical doctor at that time. And so that was really what I was gravitating towards. And then I discovered deeper dental sciences. And I was like, I think I want to become an oral surgeon instead, and become a dentist. And so that was really where that came from.
Okay, and that makes sense. Not unlike anything that, like, I've heard that kind of story many
Right, a lot of
many
people, right.
yeah, many a times. Okay, so come on, biology, knowing about public health a little bit, wanting to become a physician, then an oral surgeon. And so after you graduated from your bachelor's, you got your master's of public health. So why did you want to get your master's of public health? Or what
Oh,
was that thought process?
So for me, it was kind of strategic at that point in my life. It was really strategic in a way where it's either public health, get a master in public health, or biomedical sciences. And my thought process was really, I didn't have the grades to get into the schools that I went to go to. And, in that regard, you really have to have the grades. And so in order to push myself further, I was like, okay, before you apply to and put all this energy towards it, let's take this a step further. Let's get some more experience and go get your master's. Let's see what that works, and then take it from there. And if I really want to continue on and apply to dental school at that point, then I was going to. And that's what I did. And so that's what that was for. I fell in love with public health at that point, towards the latter half of my academic career throughout undergrad. And that was really when I got accepted to Argosy, and I was really fell in love with public health. Like, oh, wow, this is a different type of thinking here. This is something that I can really touch and really be engaged with the patients at a community level and really have an impact in terms of health outcomes and like really do some work in this regard. And so, yeah, that's what drove me to public health and to move to Atlanta and pursue that and work there.
Okay. And
Right.
before we jump in more into the Masters of Public Health, were there any other takeaways that you wanted to share about your time in undergrad as a biology major at Barry?
No, honestly, it was a time. I really had a great time in undergraduate school. I really had a great time living my best life in South Florida. I love that city. And so that's what really made me have to do something different, right? In order to get to what my goal was. I had to do something different than what my friends were doing and what my family was doing, and just take a chance on myself. And with only a couple $100 to my name, I did it.
Oh, shout out to you. Shout out to you.
Yeah, so it can be done. And so that's really was my main takeaway for myself. I really had to prove something to me. It was really personal.
Okay. Yeah, and I like that. Like, I think too many times we try to compare ourselves or look at other people and compare ourselves, but looking at what do I need, how do I become the best me, and working towards that, I think is also like highly, highly valuable. So you graduated from your bachelor's in biology. You're thinking about becoming a physician, or no, a dentist, oral surgeon, and well, dentistry in itself is like really, really hard to get into in the US. I think it's more difficult to get into a dentist school than to get into a medical school, just because there aren't as many spots. So you realize that your grades weren't good enough, but you still didn't like, you didn't cater and say, oh, I'm not going to become a dentist at all. You're like, okay, let me do this MPH, let me learn, get better grades, probably get some research experience and whatnot, and then at the end maybe you'll think about reapplying to dentist school or applying to dentist school and doing that. Am I correct in everything that I see in there?
Yeah, I really just had to pivot. I saw it done plenty of times with my friends ahead of me that were dentists or already that had done it. I knew it was possible. So it was just a pivot. You just had to reconfigure, sometimes in life.
Okay. Yeah. Absolutely. Pivoting is essential to, I think, like success in a lot of aspects. Okay. So you moved to Atlanta to get your master's in public health at Argosy University. Was there any other things that you wanted to share beyond everything that you did share just previously, or I think, does that cover your thought process for wanting this master's of public health?
The other thing that also motivated me towards public health was I went on a medical missions trip, and it was my first medical missions trip, and I did that by myself. I went with another school, and I didn't know anybody there besides one of the professors, and that had invited me. And that was when she really put me with the medical students and said, here, you want to go to medical school, this is what it'll look like. Okay, you don't want to go to medical school, this is what dental school look like. Here, go with the dental students. So I was with the dental students for the rest of their trip. And that was by maybe like a 14-day trip or so in Jamaica, across across the country, different sites and across rural sites. And that was when I really fell in love with being able with the community at that regard, just being able to triage patients that had drastic health needs that, our little class can provide that little help right then and there. How do we make it sustainable is really the question I kind of ask myself within. And like, I don't want to be a part of this just, once a quarter type of trip. How do we do that? How does that happen? How does that work? What does that look like in life? And so that's really where also I was influenced to dive deeper and go towards public health.
And were any of those students that were there with you as well, did they have like a MD, MPH, or what's it, the dental degree, MPH, or anything like that?
Yeah, so I went with on the trip, I was the only undergraduate student, or maybe one of the few undergraduate students, but they were all already dental students in their first through fourth years there, and medical students like first and third year medical students that were all in their own individual discipline programs. And so I was fortunate enough to be paired with them and be able to be paired with my peers that were my age that were also doing the same things that I wanted to do potentially, and like just get that additional glimpse of what that looks like in health systems, globally. That has really impacted me.
Yeah. And one thing I did want to highlight before I move on is like you were okay with being uncomfortable, being like knowing that you only know this one professor and everyone else was from a different school. You knew no one there's different place, working in rural settings, all of this, but you were comfortable with that, as well as you were able to gain like a bunch of exposure to all those different students that are in the dental program, medical programs, and really also get to work with the community to see, okay, what about these different aspects of health do I like and do I appreciate, and use that to better yourself and like guide your career, which I think is admirable. A lot of people wouldn't put themselves in those kind of uncomfortable situations, but I think those situations are where we get a lot of growth in ourselves. So shout out to you for doing that.
Yeah. And I wasn't comfortable at all. I was terrified. I was terrified. I knew no one. I just kept going though. You know what I mean? Like, what else was I going to do? Just play around? I mean, I could have, yes, I could have done a lot more things, but I was petrified, but I just kept going.
Yeah, you just got to keep putting the next foot in front of the other, right? During your MPH, what did you have a concentration, and what was your concentration if you did have one?
I just did a general and master's of public health. I didn't have a concentration.
What was the thought process behind that, if any?
Get through it so you can apply again to dental school at that time.
Okay. Awesome. I guess that makes a lot of sense. And then because as I'm looking at here, you did, well, at least to my knowledge, you didn't go to dental school. So during your MPH, was there a change? Well, I know that you mentioned earlier that there was a different thinking that came up for you during your Masters of Public Health that maybe like shifted you from wanting to go to dental school to staying in public health. Do you want to talk a little bit more about that different thinking that happened?
Yes, mentorship, I think, is what really helped me make a decision of what you want to do in life, and really come to the conclusion that I don't think dental school is it. I don't think that's the one. That might be a waste of your energy in that space. Yeah. And so for me, I came across again a community of friends that helped motivate me and expose me to different experiences and different places and different things of what I wanted to do at that time. And I really landed with coming across great Black women who were very influential over what I wanted to do, helping make those decisions, and helping me find internships and fellowships that, exposed me to what I wanted to do and how I wanted to do it, what that could look like, and all the infinite possibilities. And so in particular, I forgot her last name is Anderson, but shout out to her. She really helped me land a job and interview with health outcome as a health outcomes manager in Atlanta, once I was completing my master's in public health, and really helped me see what that looks like, and provide me with a lot of leadership and direction and guidance. And again, just mentorship is so important. Like, no matter what, throughout work, throughout your personal life, professional, I think mentorship is really influential. And so for me, after I finished my master's in public health, I really wanted to work at the community level, and she helped me, get my foot in the door in that regard.
Yeah, and I think that that's very important that you highlighted that, because mentorship could be the difference between you like not getting a job after you graduate and someone helping you get that position, or just like knowing or thinking, helping you think through what your next steps are.
Yeah,
Because I think a lot of the times we get clouded in our own decisions, and we
yeah,
sometimes invalidate our own experiences and what we are capable of doing, and having those mentors there can be helpful in that regard.
very much so.
Okay, well, I appreciate you sharing that. So I'm guessing that you didn't apply to dental school at all.
I took the DAT, actually. I did not do well. So it was like another sign, and that's where also, again, mentorship, like, helped me think through those processes. Like, let's logically think through this, DeLorean. If you're not getting the grades, the numbers that you want, there's something there, those are indicators for other things. And so go towards more your strength rather than your weaknesses, honing on that. And so that's kind of where that pivot and that mentorship helps think through those things with yourself.
Yeah, and I love that a lot, because I love that you highlight that, or that I asked the question that you're able to answer it, because I feel like a lot of people do feel like they're failures, especially if they aren't able to get into their doctor's program, their physician program, MD program, I should say, or a dental program or anything
Right.
like that. But to your point, it's like, this just isn't my strength. So why am I gonna like put myself through all the stress and suffering and that to not play into my strengths? When we look at your story, and we're going to talk about it a little bit later on, like, you are very successful in getting your doctors of public health, in doing a lot of work that is outside the traditional route that we know to health, which is dental, medical, nursing. And there's a path and a way for people to make that impact and do good work outside of that. And just because you're like failing at the MCATs or the DATs or whatever the case might be, doesn't mean that you're a failure. It just means that this just mightn't be the best fit for you, and there's something else that's more aligned with the way that you learn, the way that you want to practice your work, and so many different factors. So I'm glad that you highlight that before we get into more of your story.
Yes, I like what you just said too, and the way that you learn. I think also knowing how you can interpret a lot of information, how you operate, how your brain downloads a lot of information and are able to really understand it once you downloaded a ton of information in a very quick, fast, timely manner. Being able to utilize that to your advantage is really beneficial. Like, I had to figure out, how do I learn? You know what I mean? And throughout my master's, it challenged me. And so then it was like, okay, now I see why. Now I see that differently, And so that helped with me making some of those decisions at that time.
Yeah, and I think that highlights another point of like self-awareness, and just how important self-awareness is, no matter what it is, whether that's like how you learn and how you intake information, or
Mm-hmm.
what your strengths are and things like that. Just being self-aware is key in helping you guide and live like a great life. Yeah.
Absolutely.
Okay, so you graduated from your master's of public health, and you said that you were helped or assisted by a mentor to get this position as a health outcomes manager at Good Samaritan Health Center in Atlanta. So tell me more about that process, and then tell us what you did in that position.
It's really helped with a lot of grant writing, like oversight, and providing guidance and assessing the grants at that time for the organization. She was the director of the grants development. And so I was really like her assistant. And it really helped me at that time, see how I can better lead and provide strategic oversight over certain activities that, help, improve the performance of the organization as a whole and provide quality care. And so being able to have that guidance and lean into that was truly influential. And then having other professors at that time that also, that I was able to stay in contact with and keeping contact with, and again, have that additional perspective from their leadership and mentorship also helped with that role. And so for me, that was a great stepping stone. I was able to really hone in on health education and provide some insight and guidance on developing some of their health education programs for the organization and protocols. And so it was a great time. It was a great learning experience. I met some really great people.
Okay. And how long were you in this position for?
2 years.
2 years. Okay. That makes sense. Okay. And I wanted to ask more about like the mentorship. You said your mentor was the director of the initiative that you were getting into there. How were you able to find these mentors and like cultivate those relationships?
Good question. I don't remember how we met. I don't know, just networking, put myself out there. Just various events. That's a good question. I don't remember. But I do know that, throughout some of the like MAPS and SNMA, some of those type of conferences and groups that I would attend regularly, I would just, bring my resume and try to talk to somebody that looks like they were open enough to talk and just, have 3 questions and just put myself out there. And so that's kind of sometimes how I met some of these great people, is just, putting myself out there on the line. And I'm an overthinker personally. And so for me, it's really hard to put myself out there sometimes. And so really just doing that. And, this power in networking, to be honest.
Yeah. And for the other overthinkers out there, what are those steps, or what advice would you give them to like stop overthinking and to put yourself out there, to bring your resume and hand it out and to have conversations with people? What were those steps? What were the things that you did to get over that overthinking?
Oh man, what did I do? Like, I have stress balls that I usually keep in my pocket or in my purse with me. I would take 3 questions, take a couple questions, general questions that I would ask people, and it would be the same questions perhaps, but just, I would have those 3 opening questions, introductory questions that I, may take in, and that's how you get a conversation started, and then go from there. You know what I mean? People will start to open up to you, and then you just get into the swing, and then you find your own groove from there, and you become more comfortable with navigating those waters. But I always have to coach myself. I have to, re-motivate myself personally. It doesn't come from, it comes from within first and foremost, and then faith. And then again, your community helps. But I have to first and foremost motivate myself and set myself up for success by doing some of those things and leaning in towards those tools.
Yeah, and it sounds like coaching yourself while also like setting aside time to write down these questions that you're going to ask people, bring your resume, and just be proactive in that. Is like, oh my God, overthink things, but let me just ask these 2 questions and then we can go from there.
Yeah.
Yeah, and I think having that plan and just saying, okay, it's a simple 3 questions, let's do this, and just doing it makes it a lot easier, more tangible for people to be like, okay, I can do this kind of thing.
Yeah, just write them on a sticky. I usually bring a planner because I like to doodle or something in between conferences, between those type of things, and just really just talk to people. It's crazy. It's a lot of interesting people out there besides myself. And so being able to, see what other people are doing in the field or in other fields, it turns out to be beneficial, and you never know what comes from a conversation. So infinite possibilities, I say.
Absolutely, absolutely. And if you never have a conversation or never like go in for that ask, you're going to be in the same position that you were like 10 minutes ago. So it's better to just do it, you know?
Exactly.
Okay. So you were in this health outcomes manager position for 2 years. And then after this, you went in to get your doctor of public health at Loma Linda University. So was it the DrPH something that you were thinking about while you were in this position, or when did the idea of going and getting like an advanced degree in public health come about for you?
I think in retrospect, I think I might have been addicted to being a student. I don't know. I think I still enjoy the concept of learning. And so even after I finished my master's and while I was still working and still living in Atlanta, there was something more inside of me that I wanted for myself. Like I think I could have taken this to the next level. And I don't know, I still saw myself as a doctor. I still wanted that title. That part of my ego still existed, to be quite honest with you. And I still wanted to be able to provide more, not to just myself, but also to the community. Like, how can I have a deeper impact in some of these high level conversations? How can I make sure that I'm for certain in the room and at the table? Because some of the things that I was seeing and experiencing at that time were, I just, as I wouldn't have made those public health decisions, right? I feel like some of the decisions at those times, I could have made a different impact if I were able to have that type of voice. And at that time, having a master's in working, I feel like there was something more I could do with my education and training and take it to the next level to be able to provide at more a high level and be more impactful systematically. And so that's what really propelled me, because I always had that thought process while I was working. I always had that thought process while I was still engaged and still being on autopilot, but I still was lingering. And so I really wanted to just nail that goal, I guess, of mine. And so learning more about the missions and what a DrPH does and what they do and how they can make an impact and work with providers and work with practitioners, and still have a seat at the table in the academic field, in academia. That's really what I wanted to do and what I leaned into and wanted to do more of. And that will let me to pursue the doctorate of public health.
That makes sense, and I like the thought process that you were sharing around you were seeing people in more senior positions, or like in public health in general, in more senior positions, doing things that you personally don't think would have been like the best choice or the most impactful thing. And I think that's probably an issue that a lot of younger public health professionals are coming up against now.
Man,
And I
man.
think
Man, look
yeah.
at the pandemic that we're in, right? I just think
Mm.
as a public health practitioner, we could have prevented some of these things. And I wish I could have, but all in due time. Everything's a stepwise process. But just some decisions that I think if we could have had a different perspective, alternate perspective, and be able to apply that to the field and really remind the professionals who are in those roles and those decision-making roles of those concepts, and of those principles, I think, we can prevent a lot of different things.
Yeah, and I just want to like say like shout out to you for like not only thinking about this but saying, okay, what are the things that I have to proactively do to put myself in a position where the next time like something like this happens, I would have more of a voice to share what I think, and I could be in those rooms and make those decisions, which I think is something that a lot of us don't do. We will reach a point of, I could have made a better decision, or I know better, but then we don't do anything to proactively put ourselves in a space to actually make those kinds of decisions in the future. So I just like that framing, as well as you just wanting to continue to be a learner. And I think a lot of people are addicted to being like full-time students kind of thing, which it has its pros and its cons, that's for sure.
Right, it has pros and cons. It's not all practical all the time, but it just propels you and wants you. I just want to be a change agent in that regard.
Yeah, absolutely.
Yeah.
Okay, so you got your you're a doctor of public health at Loma Linda University. So that's on the West Coast. So was that a difficult decision for you to like, because I'm guessing you shifted, what is that, Seattle, Miami, Atlanta, and now Atlanta back to the West Coast, or California, I should say. But tell me about that thought process of like moving, or did that just happen to be because the program was good, or how did that all come up?
No, that was a personal decision. I personally fell in love with California on a family vacation when I was younger, and I had never been back since then. And I had told myself since that trip, I wouldn't mind living in California. And when Loma Linda's program populated on my radar of being a hybrid program where it was half online and half in person, I saw that as an opportunity to move across the country. And I took it. I saw it as really an opportunity to fulfill a lifelong dream of mine personally. And I did it, and I'm still here. And so I love California. I love all of what it offers. It's expensive as hell. It's expensive. It is not all that fun with the shotgun to be when you got to pay your gas, but it gives you a lot. Like, where else can you have a lot of mountains and water access and the views anywhere and the people, the different cultures? I love it.
Yeah, fair enough. I think that's really fair. So tell me more about the hybrid program, because I'm not too sure if I've heard much about a lot of DrPH or PhD programs just in general,
Right.
being hybrid. So tell me more about how was that experience. And I know that you said that 2 years, I think, into your DrPH is when the pandemic kind of kicked off or whatever. So how was that hybrid, I guess, prior to the pandemic?
Prior to the pandemic, it was great. I only had, depending on my class schedule, go to classes a couple times a week, and the rest of the classes were online. It was like a regular other program. So it gave you the space to work as well. All of us were all in my cohort, all professionals, all have full-time jobs, all, some have families even within the program. And so it was really flexible in that regard. And it was a 3-year option that I chose to continue through. And so I actually finished my dissertation project and completed my my program December 2021, and I walk finally this June next month 2022. So it was a great time. Very determined, took a lot out of you, mentally, physically. But I definitely learned a lot and definitely met a lot of great professors and a lot of great friends and peers along the way. I feel really prepared to enter the field now. So I'm really excited for the next level.
Yeah. That's awesome. That's exciting. And yeah, I hope that your walk next month goes very well as well. That's also exciting.
It's exciting, yeah. It's a good
Awesome.
time. First in the family, we don't have this. I don't come from a long line of doctors. Maybe some nurses in there and some great professionals, but the first of my family on both sides, and so it's an exciting time.
Yeah, hopefully not the last.
Right. Hopefully not the last. Definitely not the last if I have to.
Good.
Whether my little cousins know about it or not now.
Okay. So during your DrPH program, I see here that you were clinical research coordinator at IQVIA. So first of all, what is IQVIA? And then tell me a little bit about the work that you did there.
Oh, IQVIA is a biopharmaceuticals company. And so what happened was once the pandemic hit, our program was fully online for school. So there was no more in-person contact. And I moved back home with my parents, the pandemic. Nobody knew it was going to happen. So March, I packed everything back up and I moved back in with my parents to Seattle temporarily during that time. And so I needed a change, and I still wanted to work though. I didn't want to be at home for any more months that I didn't have to be. And so I put myself out there in the field, and that's really where I got a lot of experience as a clinical research coordinator with IQVIA, working on clinical trials. And one of the trials included one of the COVID vaccines that are being produced today and distributed. And so being able to have that experience as a clinical research coordinator once the pandemic happened, first and foremost, that really helped me later transition to my role after that with Contra Costa County as a public health program manager, and being able to facilitate also the vaccine distribution to the fields and being able to provide those operational leadership and guidance in those settings really made the connections even more clear, and really just, gained more experience. It really helped optimize, my strategic visions for myself and set the tone for the field.
Yeah, that's awesome. And I love how it plays into the other role. But tell us, how did you get that role, the next role as a public health program manager at Contra Costa County? That's a interesting word.
The power of networking. I'll say that much. Just I had someone in my program, one of my good friends. They're also in my that's also in the DrPH program at Loma Linda. Was working there and said that they're having a hiring spree. It was very time of need at that time. Public health professionals are in demand at this point. So there's a lot of job opportunity. And I saw that there was another opportunity to make a greater impact and have a remote role at that. I was commuting back and forth as a clinical research coordinator, and I was at my wit's end. And so I saw an opportunity to get a remote role at that time and still be able to provide strategic guidance. And I worked with a lot of nurses, epidemiologists, and being able to be firsthand in those conversations and be able to provide the education and relay that complex information down to the community level was really helpful, really impactful, and something that I enjoyed doing, because I was able to be firsthand with the communities. And then once January hit, our roles changed and we were deployed into the field later in 2021, to where I was boots on the ground. Things changed from that remote role. It was either you have a remote role or you don't have, or you either go back into the field or you don't have a job. And I still needed to have a job. And so being able to be boots on the ground in that regard and run different vaccine sites and administer that type of leadership and strategic guidance in that regard was really crazy because that was a busy time, but also a lot of great experience. I was able to work full time with a lot of great people and leaders at that time, and public health nurses and directors and whatnot. And so that was just part of my experience.
Yeah. That's awesome. And I'm glad that you still got to get some of the remote work, and then you were also available to do the on the ground work. Would you mind sharing something like around running a vaccine testing site that we mightn't think of, or something like that? Because I'm guessing there's a lot of logistics that goes into that we don't see or we don't think about. To share something like interesting about that work.
Oh man, what was so interesting? What can I say? So one of the vaccine sites I ran was one in the county where we took over a Six Flags parking lot, and I walked 16, 17 miles a day within that 8-hour shift, just back and forth, putting out fires, essentially, whatever the nurses needed, whatever the providers needed, and what they didn't have, I had to set them up and be really air traffic control for the whole operation setup, and really, provide the guidance and work with the city planners and city street wells, and being able to just jump right on in. That was a crazy time, but I was boots on the ground, and everyone looked to me for direction and guidance, and really had to fake it till you make it. I had never worked with city planners at that time. Like, that was my first time interacting with those type of stakeholders and those type of professionals. being able to read about it, now I'm able to apply what I've learned in the field. And it really, I was prepared. I was scared, but I did it. And I did it within, within the 8-hour shift. I walked 15 to 17 miles. I looked at my Apple Watch a day during that time, because the vaccine site was just so wide and so long and so vast, but still having to put out fires, was my job. So that was an interesting time.
Yeah. Thanks for sharing that. Not something that people think about, just how much you did have to walk, and many people in similar roles to yourself, like just having to be on their feet and having to walk a lot, as well as COVID being like a very new thing, and not people, and as well as like everything coming down from the CDC or the federal government just changing all the time, and having to keep that with your team, with the public, is all very complicated stuff. So I definitely understand that.
I had to be on top of what does the symptoms mean? If I'm going to fall out, am I going to die? All right, it's okay. It's all right. We're all scared, but here's what we're going to do. Being able to set that plan and calm people down quickly that are working, and patients on both sides of it. You have to really pivot yourself.
Yeah. I like that. Well, thank you for that work that you did there. Thank you. That very, very appreciated and needed at that point in time, for sure.
Thank you.
You're welcome. And then the last role that I have here during your DrPH was you are an evaluation manager at Interface Children and Family Services. Yes.
So I, at one point, had, I think, 3 jobs at the same time, as evaluation manager, also as the public health programs manager, and starting out as also as a full-time DrPH student who was knee deep, elbow deep, neck deep in research, in a dissertation research paper, just figuring all that out and making sure that sticks and is good. That was also the benefit of just putting myself out there, wanting something different, and the world giving me back the benefit of mentorship and leadership, and another strong, influential Black woman that sees the potential in my work, in my skill set, and was able to, help me get my foot in the door and apply even more of my academic learning and training. And so having a concentration in health education, that's really where I was able to truly apply my program evaluation skill set, and being able to apply those theoretical models and settings into grant applications, and really hone in on providing that strategic direction in that regard for those different projects, for those services. It really, I learned a lot about myself. I learned a lot about the role and more about the field. And so that was a great opportunity. I don't know much more I can say, but it was a great time.
Yeah. Awesome. And it sounds like you had like a varied experiences throughout your DrPH program that definitely played into different skill sets and learnings that you were getting from the program. So I appreciate you sharing that. So earlier on, you were sharing about your comp exam and how that like went into your dissertation. Do you just want to explain more about all of that process for us, and then maybe even talk a little bit about what your dissertation work was around?
Sure. So for my program, everybody's program is different and varies, but the curriculum is essentially foundationally the same from what I've seen across the field. And for our program, very vigorous, heavy classes in the first year. Saved all my work because it's all going to be conceptually compressed into one large exam, where if you don't pass 6 exams, you might as well, you're out of the program. Like, it's that serious. That was a very stressful time for me, and actually a very interesting time, because there was some discrepancy with some of my results. And so I was actually studying for my comp exam while I was on another medical missions trip in Honduras at that time. And And so I was out of the country studying for that, also providing as a health educator with the oral health group, the student dentist for Loma Linda University. So we were on a SIMS medical mission trip, and so just, yeah, I don't know, it was a lot. But once you get past your comp exams, then you head straight into your conceptual paper where you're focusing on any other like tied in classes, any electives that you need to finish up. And then while you're doing that, you're also focusing on your paper and your research project, and narrowing it down to your really niche area concept and your thesis, and what you really want to work on if you haven't done so already, right? Because there are people who start day one. And I know people who have started day one and have, if you finish early, that's the benefit, right? And so infinite possibilities. But yeah, that was really my experiences starting from there. I started off with one idea, what I wanted to talk about and what I wanted to dive deeper into. I probably should have stuck with that, but now that, and it was regarding mental health, I wanted to dive deeper and explore more with GIS and the resources availability with mental health services and what that looks like in the field. But I chose a different path that was more geared towards health education and it was a little less time consuming, was the benefit in that regard. But I wanted to really focus on health education and program evaluation and the benefits of that regard in that field. And so my project was essentially on Loma Linda University. They have a sister college, which is Samuel Gateway College, and they have a program for allied health professionals. And it was brand new. And I wanted to focus on, they had a plethora of data available to them, but they haven't utilized any other mixed methods. And so being able to provide a mixed methods point of view perspective on the value, or if it is, impactful and effective of a program, what does that look like to students and what does it look like to the workforce? Essentially, now that within the state of California, there's a provider shortage and a lot of population growth and evolutions happening across different regions, how beneficial are these programs and these partnerships to that dynamic and that evolution that's happening right now? And it's really affecting a lot of the underserved and under-resourced communities that already have healthcare delivery service issues and inequalities and inequities. And so that's kind of what my research touches on, is the value in the empowerment factor at the individual level that these programs provide, and highlighting how we can close those healthcare service delivery gaps by leaning in towards and optimizing those allied health professionals once they go into the field.
Okay. Well, thank you for sharing that. And what was the decision for you changing the dissertation topic? Because it seemed like the other one was decently clear cut as well, or maybe not so much. But what was that deciding factor that made you change?
I wanted to graduate on time. To be quite honest. I want to graduate on time. I want to be done. You have a certain amount of time to finish the program, but I really was getting tired. And mentally, I just wanted to, at a certain point, I wanted to be done. I'm still not done with publishing, but, I've finished everything in the terms of my requirements of everything, but that was a deciding factor for me at that point. I wanted to be able to see an endpoint.
Yeah. Yeah, that makes sense, and I think there's nothing wrong with that at all.
Ready to make some money.
As you should be, right. Especially in California.
Exactly. That's the other part about being a student. Like, yes, it's cool, but at the same time, I wanted to open up my bandwidth to be able to, put myself even more out there full time. And as a full-time student, that's very difficult to do.
Yeah, absolutely. Okay, so you graduated from your DrPH program and you currently work as a director of quality assurance at West Oakland Health. So how do you come across this job, and then what do you do in it?
Yeah, so I came across this role. How did I come across this role? It was really a great landing space for me as I was able to complete my doctorate in this role. They really were able to provide that support. And so I appreciate that. But it reminded me of my time in Atlanta when I read the job description initially. And so it kind of I saw it as an opportunity as well to further grow another organization and be impactful and a change agent as well in my community. And so their mission really for me was the selling point on moving towards West Oakland Health Council in particular. And so for me within that role, I provide a lot of direction over improving the operational projects and success for, a lot of their patient plans and clinical operations in that regard. And also leading the work groups for implementing a lot of the clinical and quality dashboards in that regard. And so for me, that's something that I like to do, to be able to provide that leadership and direction towards how can we overall make this a better place? How can we be more impactful and really truly provide quality healthcare? And so that's kind of what my role entails in the day-to-day operations, just making those decisions and facilitating those opportunities for us to really leverage to our advantage and grow the business at the same time.
Okay. Well, I appreciate you sharing that. And this is a question I guess I ask most people with like a public health background that go into like health system work. How difficult is that because I know like public health and healthcare, health systems have similar languages, but then they have a lot of different language. So how difficult was that transition for you?
It was, it was difficult, but honestly, it was kind of eye-opening, right? For me, it was really eye-opening in a way that I felt prepared because I had a class that really helped me, and a professor that I leaned into his guidance and leadership, Dr. McCleary, shout out to you, in his class, where all we did was case studies, where we did a lot of case studies and a lot of simulations, and being able to see that and read about that. And then now I'm immersed in a similar scenario. I'm immersed in similar settings where, oh, we're experiencing some of these same morale issues. We're experiencing some of these same issues that bigger companies and organizations that I read about. Now that I'm actually in one, I can do something about it. Now I can make some of those calls. So it was really for me being able to see how that systematically plays out and what that looks like. That I saw it in one spec, but now I see it and I'm able to apply what I've learned and what I know, and being able to really pull out those tools in my toolkit for success in this role. And so being able to hone in and utilize that as a strength is really what helped me and has set me up for success. And so again, I say I'm prepared for Loma Linda's program with health education kind of prepared me for some of these scenarios that I'm experiencing. It's more of a eye-opening, more of a surprise, like, oh, wow, wait, this is not like how the textbook goes. This is not how it's, wait a second. You did a SWOT analysis, let's do it, let's go, you know what I mean? And then it's also eye-opening to see that, wait a second, some of the people that are in some of these roles and within the field of public health are also not public health trained. And so there's a different conversation that you have and that you have to have, and how you have to also educate and bring people up to speed with what that looks like and why you would think this way, why you would plan in advance to prevent some of these issues from occurring, right? And so that's really where, okay, I feel prepared. Now I know some of the questions I have to ask on purpose to strategically, bring about quality outcomes in that regard. And so, yeah, that was really a transition of an epiphany rather for me.
Okay, that's awesome, and I'm glad to hear that. I feel like cases and like case studies aren't utilized enough in like our learning. I know I did quite a few of them in like my health management course, and a lot of them around like health system stuff. So less public health, more health care. But I just, as you said, like you get so much learnings from like those discussions, from going through what happened and what were the after effects, and what was the discussion that the students and the professor had to say, okay, what are different approaches that we do here? What are the different things that we should be thinking about? And I think that just makes it a lot more practical than, as you said, like reading a textbook and doing that, because it's not the same nuances that you get from a textbook
Right.
than you get in a case study, where it's literally very nuanced, because it's people and it's context and it's
Exactly.
all these different things that you can't get in a textbook. So
Right.
mhm.
It's people, right? It's dealing with people. You see how people are interacting when you're reading some of the case studies, and then you're applying it in, some of the case studies are from like Kellogg's and Kaiser and like some of the big name corporations that exist today that had starting points from way back when. Being able to see those best practices and how they have implemented certain business acumen within the settings of, wait, this is just people. These are just people doing these things. Wait a second. Let me wait. You know what I mean? So you have to pause and like really, really dive deep and lean into that for success sometimes. And that's the benefit of, I think, reading case studies sometimes and having that sight. So
Yeah, absolutely. So I hope that like more public health programs in general integrate that type of learning into their programs. I think it's invaluable.
absolutely.
Yeah. Okay, so before I move you on to the Furious five questions I ask all guests, I would like to ask you, where would you like to see yourself in the future?
Ooh, where would I like to see myself in the future? I would like to see myself in the future happy, wealthy, with my family, my friends, on an island.
Awesome.
Living our best life, whatever that looks like.
As you should. I like that.
Yeah, but no, seriously. I would like to see myself in the leadership role, starting out as an entrepreneur, more leading in towards that, being able to really just provide more for my family and my friends.
Okay, awesome. And we look forward to seeing how that unfolds for you. But we'll definitely keep a tab on everything that you got going on. So appreciate you sharing that.
Thank you. Thank you.
You're most welcome. And then the Furious Five. So the 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Stay determined. Keep going. Keep going. I don't want to, I say keep going because we need more DrPHs. We need more PhDs that look like myself, that we need more that look like you. We need more that look like us in the field. We need more. It can't just be the select few, the 1% of the club. It needs to be more of us in these positions of excellence as well.
I like that. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
Keep going. Revert back to question number 1. Okay, yeah. So what advice would you give them? Networking, continue to network, focus on that, go towards your fears, go towards what makes you uncomfortable, because that will really set you up for success down the line. And you never know what will come out of those situations. I say this again often within my own self, there are infinite possibilities to those scenarios when you go towards your fears and what makes you uncomfortable.
Yeah, that's true growth for sure. Number 3, what's something you're working on improving in your life right now?
Balance. I'm working on balance. I'm working on being able to transition from a full-time academic to just be able to work and at a certain point turn it off and turn it down. and live in the moment more. And so that's a balance. It's hard in this day and age right now with all what's happening in the world and outside, but just being able to balance.
Yeah, and I think that's especially important in public health, because you want to make impact, but at the same time you want to take care of yourself, So there's that
Right.
balance in between those two dynamics there. So yeah, completely understand that. Number 4, professionally, do you recommend anything?
Professionally, I recommend The Professional Troublemaker by Lovey Jones. The Professional Troublemaker by Lovey Jones.
Okay, no, I haven't heard of that one.
No,
Mm-mm.
that's a good book. That's a good read. That is really motivating, and it really helps you, remind you of who you are as a person individually, and a lot of growth and reflection, a lot of real straight, direct talk, but also professional talk of just growth and development. I really love her talks, and I love her work as well. She's a good one. But also for me, I like to exercise. I like to work out. I used to be an athlete in my youth. And so also another good book that I would recommend is David Goggins, Can't Hurt Me. I know he has a podcast and whatnot, but so sometimes I'll listen to his book while I'm running or in the car or whatnot, but his words are crazy. He's an insane person, but his motivation, he pulls it from deep within. It's very mind over matter. And oftentimes it is mind over matter and pushing yourself and going to the next level and really just tricking yourself, but knowing that you still have it within you. And so I like that. That's a motivation thing for me of, keeping your head in the game. And that speaks to my soul, that type of talk, that type of motivation.
Awesome. I'll be sure to link those 2 books in the show notes for everyone to check out.
Those are 2 different ends of the spectrum there for you. So you'll have fun.
That's good though. That's good. You gotta train all parts of your brain and your learning.
Right.
For sure. Okay. Number 5, last but not least, where can people connect with you?
I'm available on LinkedIn. My name, I'm available on Instagram, the Dr. DeLorean 15 on Instagram. And you can email me at any time, DeLorean Ruffin at iCloud.com. So I'm available. I will be putting myself more out there with Ruffin Consulting coming soon to an agency near you.
Awesome. Well, we look forward to that as well. That's awesome. And I'll put all those in the show notes and the description. People can connect. But thank you so much, Dr. DeLorean, for coming on. Hopefully, the first but not the last in your family to get the doctor denotation. We're really happy to hear your story, and I'm glad that I was able to have you on today. Thank you, Amari. Thank you so much. I really appreciate it. Hopefully it's not the last time we get to talk to each other. Oh, definitely not. And it's my pleasure to have you on. So housekeeping items, everyone. Thank you so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a like, leave a review, a 5-star review, hopefully, and let us know how you thought the show was. Share with a friend. And if you'd like to support, you can go to the phmillennial.com/shop and check out merch there, or you can go to the phmillennial.com/support and find out other ways to support there. But I will see you all next week.